You're listening to episode 68. Child Life Specialists talk about how they support organ transplant families. Hi, and welcome to the Child Life On Call podcast. When your child is sick, the whole world seems to stop in its tracks. Plans and priorities change, and your number one job becomes figuring out how to get your child well again. For some of us, rest, medications, and relaxation can do the trick. But for others, it takes more. It takes countless doctor appointments, invasive medical testing, therapy, surgeries, the list goes on, and then you still may not have all of the answers or results you were hoping for. This podcast features parents of children that have an illness or medical condition and gives them a place to share their own journeys and experiences. We will talk about the ups and the downs, the highs and the lows, but one thing seems to remain the same. Children are resilient and teach us more about ourselves and the world than we could ever imagine. Thank you so much for lending a listening ear and opening up your heart to these families and this podcast. I'm your host, Katie Taylor.
Being a child life specialist in this population isn't just supporting them through the experiences they're having in the hospital, it's preparing them for the rest of their life.
Hey guys, did you know Child Life On Call is more than just a podcast? We have free resources for parents, kids, and professionals. And by the way, a new app coming out in 2022. We will be partnering with facilities to empower and educate kids, parents, and the care team, and we want you to be a part of it. Sign up to have the facility you visit or work for be one of the first to have access at childlifeoncall.com. Hello, my friends. I am so happy you are here today. We are just full of fun new ways to talk about supporting patients here at Child Life On Call this month. And if you haven't heard or joined us before, this is a podcast and safe place for parents to share their stories with each other. Over the past 4 years, we've learned that even if your child has a different diagnosis than the story you're listening to, so many of the feelings and experiences are the same. So we're so glad you're here. One of my favorite parts about this podcast is while it was designed for parents, healthcare professionals and students are listening, y'all. This excites me so much because it means that parents are being heard. Not only are they talking to each other through this podcast, but they're getting to share as much of their stories as they can that clinicians don't normally get to hear about. Today is a special episode because it piggybacks off of last week. So if you haven't already, go listen to episode 67, Todd and Morgan's story. Their son had biliary atresia and needed a life-saving liver transplant before he was just 1 year old. In this episode today, though, we get to hear from that family's child life specialist. Last week, we got to hear Todd and Morgan talk about the impact their child life team had on them, so much so that they started their own small business called Child Life Coffee. And today, we get to hear what in the world that amazing child life program did to support this family and inspire them and so many others. We begin our conversation talking about why Katie and Jessica chose child life. And just like for many of us, healthcare professionals, this profession was a calling.
I knew I always wanted to work with kids, but I didn't want to teach. And everyone in my family was a teacher. So I was interested in the clinical setting. So I I went to Lesley University in Boston, and I chose a degree that I could kind of make into a child life track without there actually being one at that school. So I majored in child and family studies with a minor in psychology, and I started volunteering. I'm from Baltimore originally, so I volunteered at Hopkins when I was home in the summer, and then I also volunteered at Boston Children's Hospital and did an internship at the Jimmy Fund Clinic. So that's kind of my experience in college, and I really liked that setting. So I did a child life internship at University of Maryland Medical Center in Baltimore. And then I got a job at Georgetown in 2009, and I have been there ever since. So I came on part-time, and then I moved to full-time, and then I took over managing the department, in 2014, I think. And I've been doing that since, but I still I still do have a clinical load, which I love. I like being at the bedside, and I like still having that daily interaction with patients and their families. So that's my background. That's a little bit about how I have come to be where I am in the child life world.
That's so great. I feel like I've heard that story before of like wanting to work with kids, not exactly knowing what it was. You hear what a child life specialist is and you're like, yes, that's
Yes,
it.
exactly. That's the perfect way to say it. Yeah, I just didn't want to teach, and I was like, what else can I do? So
Yeah.
this
And this
was
is,
great.
I mean, no offense to teachers, but we kind of have the best job ever.
I know. I agree.
Me
And
too. Me too. And I'm married to a teacher, so I can say that.
there you go. And that other voice you hear is Jessica. Why don't you introduce yourself?
I'm Jessica Tyndall. So I found out about child life because I had a little friend in a family I knew through Sunday school, and I had done some babysitting for them. And she was actually diagnosed with cancer at Georgetown, which is where I work now, interestingly enough. She didn't get most of her treatment there. She ended up going to Sloan Kettering, but um, kind of following her family's journey through all that, I was very struck by the psychosocial needs and about how much the medical piece was so well taken care of and so covered. But then things would happen like, she would be at home with her brother, and her brother would want to burn everything, not burn, but destroy everything that had anything having to do with cancer. Or she'd wake up after a procedure and her mom would be like, they got all the bad guys out. It went really well. And she'd be like, who cares? They're going to just come back and kill me and roll over and go back to sleep. And she was 4. Um, so those kinds of things. And it didn't seem like there was anybody who in those moments was supporting the family because the doctors were focused on the medical piece. So I was like, oh my gosh, there should be a job that does that. And I was talking to her mom about it, and she was like, Jessica, there is a job that does that. And they're wonderful. And so she told me about it. And that's why I decided I wanted to do child life. I did my internship at UMass Memorial Children's Medical Center up in Worcester, Massachusetts, in 2010. And in January, I started in January. And then after I finished my internship, I got my first job also in 2010 at the HSC Pediatric Center. And then I came to Georgetown after that. And my job at Georgetown, when I first started, I covered all of transplant. And I was the only transplant child life specialist for the first, I'd say, 4 years that I was there. And then because our transplant program is so big and such a big percentage of our population, we restructured a little bit so that we have 2 child life specialists on transplant now. And I am one of them still. And there's also another one.
Wow, that's so cool. I love the way you put it at the beginning. Like the medical piece is taken care of, but what about the rest? I've never heard it put that way. And I think it is really a way to approach when, especially child life specialists are trying to explain the profession, right? Like it's such an easy thing to understand. Like we help take care of, we say psychosocial, like everybody knows what that means.
Right.
But
Yeah.
kind of the way that you explained it was really, really cool. And so I'm curious, tell me about this transplant part of your hospital that you serve. And it sounds like you started that whole child life program there. And what was that like?
So I didn't start the child life program in transplant. Before I started, Katie was covering transplant.
Okay, gotcha. Okay,
But
well,
I've
props to you,
just been-
Katie.
Yeah.
Thank you.
When Katie moved into the manager position, that's when they hired me to start covering transplant.
Got it. Okay.
I covered transplant for probably 4 years before that, and before I was specifically in transplant, it was just a 2-person program for 43 beds at that time.
Wow.
And so I don't remember what I did in the first 2 years because it was, just trying to keep your head above water and seeing all the patients. So after a while, we were like, the transplant kids really need somebody to be focused on them because they are our most chronic population. So I just kind of devoted myself there. And then when it was time, when I took over managing our department, I just realized I couldn't do it, do the transplant kids and managing it just wasn't going to be feasible. So we were lucky in hiring Jessica to take on that population, which the program has just grown so much since then.
That's amazing. How big are your numbers? I guess just to give everybody a perspective about who you guys see.
We transplant about 40 patients a year.
Okay.
And I think in terms of small bowel transplant, where I believe, don't quote me on this, but I believe we're one of the largest programs on the East Coast.
That's amazing.
Well, I know we're one of the largest programs. I don't know if we're actually the largest, but I think we're in the top few.
Okay. Gotcha.
And then we also do a lot of liver. Most of our transplants are isolated liver.
Wow. Well, it's interesting. I am 68 episodes into the Child Life On Call podcast, plus over 10 years of being a child life specialist. So I have heard a ton of stories and conversations with parents. And this family, the emo family that I met, I have never heard about a family being so enamored and impressed and motivated and supported by child life specialists that they themselves started a small business after having a chronically ill child. I mean, it literally blows my mind. And this is the emo family, and that's how I got connected to you guys. And I just had to hear, what is the work you're doing there? Because you're making such an impact, and you just should be so proud of yourselves and your team. It's just amazing.
Well, thank you very much for that. That is very sweet. However, you need to know that this family is also and it's not really us. It's really them.
That's such a childlike thing to say.
They are so wonderful, and I completely agree with what Jessica said. They are just the sweetest family, and they have gone through so much and come out they're just wonderful, and James is doing great, and it's so fun for us to be able to see them in a non-medical way now. Half the time that they come to the hospital, sure, he has an appointment at the transplant clinic, but then they come to see us just to drop off coffee for all staff and all the families, and it's so nice to see them.
That's amazing. Yeah, when I was talking to them, so to kind of give you a frame of reference of where my brain is right now, I'm part-time clinical and also the supervisor. So I work in a small children's hospital inside of an adult hospital. So we don't have a lot of chronic cases. We see a lot of acute patients. And so when we prioritize, we typically don't get to see the infants. And the reason for that is we are covering a whole hospital. So
Sure.
When I think about James's story and how he was 7 weeks old when he came to you guys, and this family just felt, and I know you're busy. I know you're busy child life specialist. You have a whole transplant unit. Tell me what you did with this family that maybe I would have just otherwise, put on the bottom of my priority list. I still would have seen them at some point, but you took their experience and you made them feel heard, advocated for. I mean, tell me the things you did with this family.
So I think I hear what you're saying, because I think it is so easy to put the newborns and the infants on the back burner just because you know that they're not going to understand no matter what you do. And there are kids who will. But yeah, so one thing about transplant is because it's a lifelong thing, you get your surgery, but then you have follow-up care for the rest of your life. You have medications every day, twice a day for the rest of your life that have to be taken at the same time, or you risk infection. And you have lab work that has to be done every month, maybe every 2 months eventually, but that's as far apart as the lab appointments will ever get. So these are really, really chronic kids. And being a child life specialist in this population isn't just supporting them through the experiences they're having in the hospital. It's preparing them for the rest of their life, basically. And so that is just kind of a different mindset, I think. And, from what we know about child development, we know that when kids are very young, their brains are very plastic, and it's much easier to kind of get them into good habits and teach positive coping and get them on a track to cope well later than it is once they're already, let's say, teenagers and are non-compliant and are having problems. And so in a way, the youngest kids sometimes are more of a focus just because the sooner we can get at them before they've had that medical trauma, before their families have kind of fallen into these patterns of noncompliance or have had trouble coping, the more effective we can be in the long term. So sometimes spending a short amount of time with a little tiny baby, its family in the beginning can save us a lot of time down the road. So it is worth it, even though they don't always seem like the highest priority in that moment.
And I will also say, I think that Jessica and I are very spoiled at Georgetown because things have changed because of COVID, as they've changed everywhere, but we're really lucky in that we have a staff of 3 full-time child life specialists to cover. Right now it's only 15 beds because of COVID. Before that it was 28. So we're lucky that we can say that every kid at our hospital sees a child life specialist every single day. It doesn't matter if they're having something done. It doesn't matter if they're a short stay or a long stay or a chronic patient versus a short-term patient. We're just able to meet that need because we're really well staffed for the number of beds we have. And I know that's not true in a lot of places. So I think that that's something else that's definitely on our side. And especially with our transplant population, having 2 child life specialists and splitting that population by organ, so they're really able to devote that time. And in addition to that, we're able to follow them when they're in clinic. If they have blood draws in clinic, we'll go to clinic for them. If they are having a sedated procedure with our sedation team, or even with the anesthesia team, and we see it on our schedule, then we're able to follow them through all of that, which I think is really great and gives us continuity of care with these patients and really allows us to get to know them as well.
We will be right back. I don't always get the parenting thing right, actually hardly ever. But when I come back to 2 of the basic values in our home, it's this: reading is a treat. It opens doors to opportunity and imagination like nothing else can. The second is children and people of color who don't look like us are important and have stories to tell. We need to listen. Jambo Books was the answer to both of these important staples in my house. We get 2 to 3 fun books every month that feature children of color. The stories are engaging and beautiful, and my favorite one so far has been Those Shoes by Maribeth Bolts. Learn more at jambobooks.com/childlife. Man, that is just what every hospital should be like.
I know.
A patient load of 4 to 5 would be legit. I mean,
well, and to be fair, that's a COVID.
Sure.
It is exactly.
When James was transplanted, he was on a unit of 15 beds that I covered by myself. So
Exactly,
it wasn't exactly 4 to 5, but it was still a really good ratio.
Well, I like the example that it's setting because, hopefully staff gets used to having that around. Like as you guys are speaking, I just keep thinking like, man, these doctors are so lucky with when caregivers feel empowered, when children are addressed and assessed and supported from a young age, they're going to have better outcomes, better compliance. I mean, they're just so lucky to have you guys on their team. It's amazing.
And the other thing that I think, we have such a good working relationship with our medical team, which I think is absolutely necessary to be able to provide these kinds of interventions and have the impact that we do on families. We work so closely with our nurses, with our attending physicians. We're a teaching hospital too, so we also work with the residents and nurse practitioners. So I think that that's really important and has really allowed us to do our job better as well.
Oh, I just love that. On the topic of interventions, I know this will be a hard question, but would you guys talk about some of your favorite things that you do for this transplant population that you think is really special and maybe different than what other child life specialists or professionals or parents have heard of before?
Sure. So one thing that we do, which kind of leads into what I was talking about before with supporting these kids long term, is we see them obviously while they're inpatient. We prepare them for transplant. We help support them throughout that whole process. But we also see them for their outpatient clinic visits and their annual visits, even when there's no procedures or nothing stressful happening. And when the floor is busy, we still make the time to go down and see each kid at least once a year at their annual visit, because we are helping them follow up with their coping and their education about transplant as they grow up. And I think that's something that's missing from a lot of programs, because we kind of, and it was missing from our program too until we started doing it. I mean, it's not like, it's always been that way, but the kids grow up, and once they're not in the hospital anymore, they're not inpatient, they're not sick, they're not having, they're having blood draws, but they cope well with blood draws, so no one's going to call us for that. There's no reason for them to see child life, and we have those more acute cases up on the floor. But what we found out is that you have a lot of kids who are, for example, 8 years old, had a transplant when they were maybe 8 months old. Nobody talked to them about what their transplant was for, why they had it, how it worked, what their medication was for, why they needed to take it, how they felt about all this, how to talk to their friends about their scar, how to maybe tell their college roommate someday about why they take medicine and why it's important. And so we have 8-year-olds who didn't even know they had a transplant. I met a patient who was 9 years old, actually, who thought she had her appendix out when she was little, and that's why she had a scar in her belly. And she didn't know what her medicine was for. She just knew she was supposed to take it because her mom told her to. And so, these are kids who would fall through the cracks if we weren't seeing them, but we have a program where we go through each developmental stage and we kind of check in and we update what the kid knows about their organs, how their organs work, and what a transplant is, and what rejection is, and what their medicine's for. And then we talk a lot about coping, like, what makes you different than other people? What can you do if somebody sees your scar? What are you going to tell them? What do you tell them when you want to talk about it? What do you tell them when you don't want to talk about it? What if you see someone being mean to somebody else who has a scar? What do you do if it's time to take your medicine and your friends are around and you don't want them to see you do it? What do you do if you're out with your friends and you realize you forgot your medicine, but it's time to take it?
I love that. It's like you have the ability to, typically we're meeting kids during times of trauma and unknown. And so we're having to deal with a lot of layers, right, on every intervention that we're giving. Whereas when you see someone at an annual clinic, the layers are not necessarily there. There's different kinds of layers, but it's not the stress and anxiety layer of the unknown. It's a little bit different, so you have some more leeway, and I think that is such a good perspective. And it sounds like it's making a lot of headway, like you're making a big impact in their lives.
I hope so. I mean, I think one thing about it is that because we get to know them so well when they're inpatient, and that goes back to the whole, like, you're really the building rapport piece, I think, is the piece that we focus on the most when they're inpatient. And that is not just the patient, it's also with the family, which is why the infants don't necessarily get less attention, because their families are also going to be our patients for the rest of their lives. And then when they come in for their annual visits, even though maybe they haven't seen us in a year, they remember us and they're excited to see us. And we have kids who come in and, their parents will say things to me like, oh, yeah, they were so excited we were coming here because this is the hospital where Jessica is. And that's just like, that stuff just makes everything that we do so worth it, because that means we're doing our jobs.
I think that what Jessica has started doing in the clinic has been really beneficial, and is so needed in this population. We see so many teens who stop taking their medicine because they don't want to be different, and just trying to pick up those pieces of figuring out how to prevent that from happening and giving the patients that sort of power over their health care has been a really great thing to watch Jessica kind of put together. And then I fill in for her when she can't be there. We work a lot with the Hope for Henry Foundation too. So they actually found one of our child life specialists who wasn't there at the time that James was transplanted. But I think that one of the things that I really like doing, and I'm saying this because I did it today with a patient. She is a post-transplant patient and she is having some complications. And so they have a incentives program. And so I get to pay whenever she picks challenges for her while she's in the hospital, and I pay her in Hope for Henry bucks. And then she gets a prize, and she's still figuring out what that prize will be. But it was so great because today I just sat with her while she did it, and we played on the iPad. And afterwards she's like, okay, you owe me my money now. And I said, yes, I do, my friend. How much do I owe you for this? And we pulled out her form that has everything and the monetary amounts with each different thing. And we talked about all the things, and she could tell me everything and tell her mom, and we figured out what I owed her. And, it gives my patients power over something that they don't want to do necessarily, but they know they have to do it. And so we're just able to help them make it that much better. And so that's something that I really like. The other, sorry, I feel like I'm only going to talk about their programs, but another one that I did today was decorating kids' hospital rooms. They provide things to make their hospital rooms more homey. And so being able to do that for our transplant kids, especially, we do it when they're transplanted. And it just it makes, even for infants, we do it now for babies, and it makes the parents so happy. They just enjoy the time that you spend decorating their room, and they help you, and it just makes it feel a little less sterile of an environment.
A little bit goes a long way.
It does. And I feel like those are just two things that we are lucky enough to work with this foundation, have access to, that really make a difference for our patients and our families and our chronic patients. So I think those are two of my favorite things. I've been at MedStar Georgetown so long now that I have some patients who I can say to them, I used to carry you around when you were a baby.
Yeah.
And they're, 9 and 10, and they look at me like I'm crazy. And I'm like, no, really.
I love that kind of relationship.
Yeah. And it's great because we're their transplant center. So we will follow them until they go to the adult world.
That's amazing.
So I think it's one of the more rewarding things about working with that population.
Definitely. You mentioned Hope for Henry, and it just sounds like an amazing organization. I don't know if there's any others specifically for transplant families resources that you share that you think other parents or professionals would find useful.
Well, Hope for Henry works with us. They serve all of our populations. So
yes.
that's the thing that I love so much about them. But we do, Jessica and I refer kids to Make-A-Wish for transplant because they are eligible for that if they've had a liver or a small bowel transplant. And then we refer to some more regional nonprofits. Jessica, are there any others that you can think of that are, I guess, more national?
Icing Smiles is national.
Oh, that's right. Yes, we do Icing Smiles. So they do birthday cakes for kids free of charge for their birthdays, which are very cool. We've had a lot of patients do them, and they're the really fancy, on a TV show kind of birthday cakes.
Oh, that's
that you
so
would
cool.
see them.
Yeah. Have you guys heard of Confetti Foundation?
So those are really cool. No.
Oh, they do birthday boxes too. So they send a box for free, and they'll give you specific ages, and it's stuff to decorate the room, and it's actually got plates and napkins which would be great to go with the cake.
Yeah.
Gosh, aren't we so lucky? All these organizations that just show up when you need them the most?
Yeah, we are so spoiled. I mean, we're just lucky because I say to people all the time, we have 4 positions in our department. We're very small, and only 2 of them are funded by the hospital. The other 2 positions, we have a full-time hospital school teacher as well, which is a whole nother piece for the transplant kids, which is wonderful. But our full-time school teacher and one of our child life positions are donor and grant funded or funded by foundations.
That's amazing. That's
Yeah.
amazing. What are some of the challenges of working with a transplant population?
I think the biggest challenge to me is just, you think of, I talk about the importance of getting to a kid before they've had a bunch of medical trauma, before they've had bad experiences and, habits of poor coping and things like that. But actually, most of our kids don't come to us first. Most of our kids come to us from another hospital. Because if you think about transplant, right? Like no one has a sick kid and is like, oh, I think they need a new organ, right? And then your local team does everything they can. And then when they run out of things they can do, they refer to us. So most of our kids come to us with a lot of medical trauma because they've had a lot of medical experiences. And they've been really sick. And some of them come from small community hospitals with no child life at all. Some of them come from huge hospitals that has child life, but like maybe not in the middle of the night when the kid was rushed in. So, we have a lot of kids who have never worked with child life before, or if they have, it hasn't been, as much as they would at our hospital because we are so well staffed. So, and we have a lot of kids come over from the Middle East, actually. We have, I think, 10 to 20% of our transplant population is like straight off the plane from the Middle East. So they also typically come with a lot of medical trauma.
Yeah, I would think that as well, like just thinking about your role there and the conversation about a wait list for an organ has got to be a tricky one.
Yes. And that's really hard too, because it depends on the age of the child, right? Like if you have an adolescent, you can talk to them about that and they'll completely understand it. But if you have a little kid who doesn't even understand the difference between like tomorrow and next week, talking about the waiting list. And the other thing about the waiting list is that it's not like when you're waiting in line and it's going to be your turn soon and you can talk to them when it's almost their turn. It's like it will happen anywhere from tomorrow to 4 years from now.
And we also
that's
have
difficult.
kids who come in multiple times and maybe the organ doesn't work out. Most of the time when we know we're getting a liver, we bring in a primate patient for it, and then we bring in a backup because sometimes it doesn't look quite right for that first kiddo, and so we want to be able to give it to someone else at our hospital. And that can be really hard for families too, and they're told that, they're told all of these things in the listing process, but I know it's information overload for our families when they're in the listing process. And so that's definitely something, that we help try to support families through when they have to come in and then, they do get sent home. And most of our families are really understanding and amazing about it. But it is hard.
For sure. Yeah, it's amazing when faced with such challenges how people just rise to the occasion and teach us so much. And it really sounds like the emo family has absolutely done that. When they talk about you guys, when they talk about what Child Life did for them, Morgan specifically talks about how you guys taught her to advocate and ask questions and how that just gave her so much esteem, right? Sitting in rounds with the multidisciplinary team and just the difference you made for her was incredible. And if you've listened to this podcast before, I'm just a huge proponent of empowering caregivers because I really feel like they are such a large part of the success of kiddos in the hospital. And so when you empower caregivers, you're ultimately empowering the whole family, including the patient.
100.
Yeah, absolutely. I mean, who knows their kid better than their
Totally.
parent. That's what I always say.
I know.
And I honestly, I kind of think about my job as to work myself out of a job. Like,
Totally.
If I can get the child to cope well and the parent to support the child well, the parent's going to be there at those 4 a.m. ER trips. I'm not.
Yeah.
So,
it's funny you say that. I work in our NICU mostly now, but I was helping out on the outpatient radiology, and I was in a room and I was like, whoa, I hope that I end up being invisible in here. Like, I really hope that I'm just like kind of helping to facilitate what's going on, but that I'm not actually here. It was like such a weird way to want to be, but I think does that kind of make sense to you guys?
Absolutely. Well, and that's
100%.
That's kind of what happened with the emos. And it's funny because right before we got on the phone with you, we were talking about like, what do we say about this family? Because in my mind, I was thinking, this is such a good, easy family. Like, I don't feel like I did anything to help them because they are so amazing. They don't even need us. But then I stopped and I thought about it, and I'm like, try to remember them when they first walked in the door.
Yeah.
And what I remember about when they first walked in the door that very first day, this is a strange thing to remember, but they were both wearing pink shirts. And
Sweet.
I thought they did it on purpose. And I was like, oh my goodness, who is this family who color coordinates their outfits while their kid is in the hospital?
Yeah.
That's amazing. And they totally did not do it on purpose. I didn't even realize they were wearing the same color.
I love that. That would definitely make them laugh for sure if they knew you remembered that.
But they were, young parents, right? This was their first child. And when you have a new baby who's that age and it's your first child, you're anxious anyway. And there had been complications, and they were in a transplant center with their new baby. So, of course, they were anxious.
Yeah.
And I have to remember, like, the person I saw when I met Morgan is not the person that she saw when she looked in the mirror. And I have to remember that because I met her and I saw the woman that we know today, right? I saw the woman that was going to be an amazing advocate for her son and amazing support, and who wouldn't even need me in the room for pokes because she just got it. And who would be starting her own business, and, now they have another child. So just amazing advocate and amazing support, amazing parent, amazing nurse. She was like basically his nurse at home for a really long time. But she didn't see that person, right? She looked in the mirror and she saw a new parent who didn't know what she was doing.
Yeah.
So I guess our job is exactly what you said, right? It's to take the parents where they are and help them get to where we know they can be. I think the best analogy I ever heard, and I wish I remember who said it, and I probably wrote it down somewhere and lost the notebook, but at one of the child life conferences, the opening speaker said that a lot of, and I might be butchering this a little bit because it was several years ago and I'm not quoting directly, but they said something about a lot of people who don't really know a lot about child life, or new child life specialists who don't, haven't started working yet or whatever. Or even like kids or families sometimes see child life specialists as superheroes, right? Like, we come in and we save the day, but it's not that at all. If you think about the analogy of Superman, we are not Superman. We are the phone booth. We are like the people who help the kids and the families figure out that they're already superheroes. They just don't know it yet.
Oh, I love that. That is so great. It is so true. Like, the more that we can blend in and not be necessary, as you put it, work ourselves out of a job, it's like that's the real win for us.
Yeah.
It's like when you get a kid to a point where they, they're so traumatized. They come to you so traumatized, and they do horribly for blood draws. And Jessica and I have several patients that are like this, that are transplant patients. And it's like when you get to the point where either one, they're just sitting down and sticking their arm out and don't need held anymore by a parent and don't need, constant distraction for it. And they just know that they can do it and that it's not fun, but they can get it done. Or I'm thinking about another patient, and to be able to know exactly what they need in that moment when they have to get that blood draw or when they have to get that port access, and just being able to like come in and help them get that done. And like you said, just blend in and just be part of the scene, but not, still let the kid be the star of the scene or the parent be the star, and help them just as a background person. It's so rewarding to see kids get to that point.
Oh, that's so true. I just love that. Oh, I want to say jealous, but I know that's not the word, but I just think it's so cool how you guys get to watch kiddos literally throughout their lives and kind of build this relationship with them. And I just think that's incredibly special. And it sounds like you guys have an amazing team at MedStar Georgetown, and I'm sure they're just so proud of you.
Well, we are super, super lucky to work with this population. We definitely feel that way for sure. Another thing that Katie kind of said to me when we were briefly texting before this conversation is, we were talking about like, what did we do with James that was so impactful? Because I just, I really just feel like it was his family. It wasn't us. And Katie was saying things like, well, we're very present with them and we like listened to them. We validated their feelings and like, okay, but like, that's what we do all, like, that's so basic and easy. Like that can't have been the most impactful thing we do. But actually I think sometimes it is. Sometimes just like being present, being in the room, like, not like having that, like I'm watching out of the corner of my eye to see if another procedure is happening in the next room and I'm waiting for my phone to ring, and, like sitting and being present with that family and like making them feel like they're your only family that you're taking care of today for even a few minutes. And then just really listening and meeting them where they are. If you're really doing that, then you don't need a specific, amazing, creative intervention. You just need to be there. And because you're a child life specialist, you'll know how to help the family.
I love that. I think that comes with maturity in the field too, right? Just your comfort level, and not caring if staff sees you stand in the corner, like, what you're doing right there is what you should be doing. So, yeah, that takes practice and confidence, but once you find that little sweet spot, it's pretty great.
Yeah.
Yeah, I would agree with that too. I was just thinking, like Jessica said, we were texting before this, and I was thinking about one day when James was still in the ICU, post-transplant, and I just remember sitting in the hallway with Morgan, and I just sat down with her and I just talked to her for I don't know how long. And I think that, like Jessica said, it was just more active listening and validating what was going on and how hard it was. And I agree. It's, I don't feel like that was anything huge, but I definitely think that that's just something that we're able to do. We're the safe people for families in the hospital. We're the people that they can talk to about things they might not feel comfortable talking to anyone else about. And I think that that's something really important that we always in our field have to remember. And it's such a privilege to be able to be in that position and know that families want to tell you things, and then you can try to help them solve any issues that they might be having, or just listen to them and validate what they're going through.
Or help them realize they already know how to solve the problem.
That is true.
Don't realize that they can actually do it.
Exactly, that too. And it does definitely, I'm just thinking about like when I first started in this field, like I was not, I can't imagine myself just sitting down and talking to a parent like I did with Morgan. I definitely think that's something that comes over time. It's not going to happen right away. It's really important to just keep putting yourself in that situation, to talk to families and get to know the parents and the caregivers, because we're not, as we all know, we're not just taking care of the patient. The entire family is affected when a kiddo is sick. So anything that we can do for that family is going to help that kid get better.
And I'm going to be completely honest. When I first started out being a child life specialist, maybe even before I started out, I was kind of afraid of the parents. I was like, give me a kid with no parents at bedside where I can just deal with the kid. I don't have anything to do with the adults. I did not go into a field to work with kids so I could deal with adults. Like, that was completely my attitude inside my head in the very beginning. And now that I'm actually doing this job, it's the complete opposite. It's like, obviously I love spending time with the kids, but like, there's no separation between them and their family in my head or in my heart anymore.
Right. Oh gosh, I think you're not alone in that. I think all of us felt that way. Like, yes, I'll go in and that's okay,
Yeah.
Mom. You can take a minute.
Exactly. Can I relieve you?
Yeah.
Do you need to go get coffee?
Yeah, I think
Do you
we've
need food. I want you to
totally.
eat.
Oh gosh, I know. And some of the beauty comes actually in parents watching us interact with their child and being like, wow, there's somebody here in the hospital that will sit with my child. It's just, gosh, like what you said is just, this is a complete privilege.
Yes,
Mm-hmm.
it is.
Absolutely.
It is. And you learn something from every single family. Like, every single family I've worked with has made me a better child life specialist, so much more so than they would have if I was just like only focused on the kid. The kids will teach you obviously a lot too, but you learn more if you also learn from the families.
Yeah, I love that. Well, this was so great, you guys. And I just want to thank you so much for being so candid and so honest about it. And I think it would have been really easy to come up with some crazy intervention you did for this family, right? That was like, yeah, we're the best. And you are, because of you're just doing what you do every day. So I think that's just so great. And I really appreciate you being here.
Well, thank you so much. This was fun.
Yeah, this was so fun. I was kind of nervous, but this was no problem at all.
Yeah, it's so fun. Well, I hope you guys find it as a resource for the families that you serve. And, I really started this podcast because I was in this small hospital, whereas I'd been in bigger ones, and parents could share stories in the break room or go to bingo and meet each other. And like in the small hospital, I just had a mom crying in a rocking chair saying, has anybody else ever gone through this before?
Oh.
And it's like a podcast is just such a great passive way to hear somebody talk about something that's hard, and you don't have to do anything. You can just listen and feel like you're being heard as well.
Absolutely.
Yeah. That's awesome. I didn't know that's why you started it, so that's amazing.
Yeah, she had a 3-week-old with meningitis, and she literally looked me in the eyes. It was like, has anybody ever gone through this before? And I was like, oh my gosh, yes, and
yeah.
I was like, I wish I had a podcast I could just press play. And now I can, and it's such a beautiful thing.
We used to there are multiple reasons why it's kind of on hold at the moment, some of which are very obvious, but we used to run a parent support group for the transplant families. And even for transplant families, we'd get that a lot. Like, I'd have families being like, oh my gosh, all these other families are in the same situation I'm in. And it would be like, yeah. And along with hundreds of others all around the country. And the things that they would say, like the same themes would just come up over and over and over again. And you just wanted to be like, let me record this and play it for every family who walks in here and feels like no one understands them, because everybody understands this thing that's going through it.
100%. I had a mom share really early on, her kiddo has a very rare genetic condition. Like, we're talking 1 in 7 in the world. And she says that she just nods her head in agreement into almost every episode she listens to. And she's like, I thought there was no one else who got how I felt, but it turns out the diabetes mom gets it. The seizure mom gets it. So we get it, and I just think that's so powerful.
Yes, 100%. Yes.
Thank you so much to MedStar Georgetown University Hospital for letting us talk with these seasoned and skilled essential workers. Getting to share the child life perspective with you all only strengthens the relationship parents can have with their care team, and I think the Emo family and these child life specialists demonstrate that so perfectly. I will see you all next week as we get to recognize Lyme Awareness Month and how this somewhat mysterious illness has affected one teen and her family. Her mom shares how her daughter completely changed her life and inspired her to do a new calling. Have a great week, and I'm so grateful that you're here. Thank you for listening to the Child Life On Call podcast. I'm your host, Katie Taylor, and you can follow us at Child Life On Call on Facebook, Twitter, and Instagram. Please rate and review to make it easier for other families to find us. We have cute merch available at www.bonfire.com/store/Child Life On Call, and you can listen to more episodes and find resources at childlifepodcast.com.